Hello, everybody. I'm Dr. Stephen Clark. Thank you for joining us today at the Black Medical Journal podcast. Today, I am joined by Dr. Brandy Dedè and attorney Doris, Dike, and we're going to be discussing all things related to concepts of beauty and cosmetic surgery, the legality of starting businesses in this field, how it affects your psychological stability, how it affects our kids' psychological stability. So if you have almost any part in this world, you will find something you will find attractive and interesting to talk about today. Okay, ladies, first, tell me a little bit about what you do and how it relates to concepts of beauty in this ever-changing world. Like, I'm a plastic surgeon, so I deal with beauty all day long, and I deal with how, people think of themselves and what they're trying to be. And I can see changes. I can see changes on what's important. Believe it or not, what we find attractive changes just like styles change. Just like your parachute pants you wore in the 80s change. Now that people wearing skinny jeans or to fitted suits. Those things change in cosmetic surgery too. What we did in the 90s versus what we do now with BBLs, which kind of favor, African Americans. So tell me about what you're seeing. I know, Dr. Dedè, you work with children in schools, and my attorney, legal friend here, you deal with a lot of startup businesses with people in the nurses who are doing cosmetic injections and med spas. So, it permeates in all of the society now. It's not a taboo topic. Everyone we know either has had plastic surgery, knows someone who has in that field. What are you guys seeing? I guess we'll start with you.
So on the legal front, a lot of providers are interested in getting into the aesthetic field, not just nurses, but I'm seeing other doctors who are trying to differentiate themselves and have a cash-based business. So as you know, as a provider, as a physician, insurance can be very challenging. So they say, okay, well, I'm a good doctor. Can't I just do Botox? Can't I just offer these services? How can I offer services in my already established practice where I can add more services to the patients I'm already seeing? So I'm talking about primary care doctors. Hey, can I do some Botox? Or very frustrated nurses who are just trying to start and offer that type of business because they know it is a cash cow. Aesthetic businesses make a lot of money, and you don't necessarily have to offer plastic surgery. Women want their lips done. They want Botox because they're aging. And with semaglutide and Ozempic, a lot of providers are trying to offer this in a way that can be safe. What I'm seeing on the legal front, though, is the Texas Medical Board is being very aggressive with how they are regulating these practices because sometimes we're seeing bad outcomes, right? Mm-hmm. Everybody's not a plastic surgeon. Everybody is not a doctor. And we are seeing people who are not even in medicine, who are not nurses, who are just people who are trying to get into the field and offer these services, whether it's on the down low and doing things in hotel rooms, mm-hmm. or, people who are just trying to cut corners and they are not following the standards of medicine because this is a medical practice. You have to follow TDLR, you have to follow TMB, you have to follow the standards. And if you don't, you will get shut down. And some of it can be felonious. It is a felony if you're practicing medicine without a license. So, some people kind of push that standard. That's why I'm hearing a lot of I love my clients, but some people push it and they say, oh, I don't need a doctor. I'm like, that's you do.
Well, I'll tell you as a plastic surgeon, of course I'm biased, but we see this all the time. Okay. And it's kind of sad because the general public doesn't know. In Texas, you can do any surgery you want to, regardless of your specialty, so long as the facility you're doing that surgery in or doing that procedure in approves you. I'm a plastic surgeon. I'm board certified in general surgery, hand surgery, and plastic surgery, all three. Legally, I can actually do brain surgery. I never would. But in Texas, I could. But what does the public know? And a lot of times they say, oh, with this med spa, they have like a cosmetic surgeon here. Watch out when you see cosmetic surgery, just so you know. A lot of times those are OB-GYNs and general surgeons who have done like a year of training and that aren't really approved to do any of this stuff, but they legally can do it. And like I said, the public doesn't know, but the Texas Medical Board does, and that's where we get into, problems and people being sanctioned and such. So it's like the Wild West right now when it comes to med spas and injection clinics and things like that. But I think as long as people want it, people are going to do it and push to try to get it done. So we're inundated with it now. And speaking of inundated, social media, which kind of lets me kind of turn to you, because what are the kids doing? Social media. My kids watch more YouTube than they watch regular TV. They are all on TikTok. They are all on Snapchat. They're all on, I'm getting old, so I can't remember all of them. You guys can tell me some of all the other apps. But tell me about the changes you're seeing, because how long you been in practice?
15 years.
Okay. So tell me about the kids' issues you're seeing 15 years ago when it comes to self-image and body concepts versus what you're seeing now.
Right. Well, as you said, they're inundated with the images. They didn't have as much exposure, I would say, right? 15 years ago, there was still more exposure than when I grew up, for instance, or when you grew up, right? But they truly are seeing through YouTube, through Instagram, like you said, Snapchat, and so many other platforms that I can't even keep up with, that this is what is accepted. This is what gets the likes. This is what goes viral. And many of it goes back to the physical state, right, of what they look like. And so that's defining, or at least contributing to how they define themselves and what is accepted by society. And so it's a conversation that comes up quite a bit with the young people I work with. And even though we see more, I guess, concerns with children who are in that adolescence age, it seems like it's getting younger and younger and younger, with kids being concerned about body image and physical appearance. I mean, as young as like 3 to 5, where you see kids just making comments about body parts. And so, because again, it's what we emphasize a lot in society. And so it's making an impact, right? So as a school psychologist, I'm trying to find ways to balance, right? Like, how do we, yes, we want to care about our bodies and how we present and how we show up, but what about the internal piece, right? How do we develop, internally? How are we beautiful holistically, inside and outside? So it's a lot of messaging I'm having to combat.
Yeah. I had a mentor of mine. She's a plastic surgeon down there in Houston, and we were talking about social media and how powerful it is. And, I'm kind of old school. Like, I kind of feel like my surgical results should speak for themselves. And that's how I should, get business. And she was like, nah. And she's probably 10 years older than me. She's like, listen, it's like rap music. It ain't going nowhere. Okay? It's only getting bigger, bigger, bigger. So you basically need to get on board and kind of do it, I should say, the right way. Not to say there's a wrong way, but do it in a way where that it's honest, okay? So I've had to, jump on board and, get on social media more so than I feel comfortable with. And my staff, who's younger than me, they kind of run it. And what's surprising to me is most of the people who know the most and who are like my followers, 22, 20, yeah, like young. And, but they're the ones who are all over it and kind of driving it. People my age, in our 40s, we're kind of like on the bus, along for the ride. but we are not driving.
Right. So, well, I will say that, I represent a lot of doctors and nurses. In a lot of plastic surgery contracts now, social media is in the contract. And I represented one provider, one plastic surgeon, where he wanted to leave, and to leave the contract, leave the job, he had to pay to take his pictures with him. And it was like $200,000 to take the pictures of the work that he was doing on social media, because that's driving the traffic to that business. So it is a huge thing.
Yeah. some people think it's kind of new. I don't really think these concepts are new. I just think now we see them, okay? People have always been vain. They've always wanted to look a certain way. And that's, I deal in vanities. I love it, okay? But now everyone can see everything. Everybody can be famous. You can be, if you look a certain way, you can be a star. And I think we have to recognize that, but also put a handle on that, because we don't want everyone thinking that's their entire essence. We've had a good chat so far, but we're going to go to commercial and then we're going to pick right back up.
I don't remember how it started.
Go to that.
Our back and forth. It always came back. Dad! You probably don't remember what you told me.
That was perfect.
But I heard every word.
We're back now. Thank you for joining us at the Black Medical Journal podcast. If you missed us, we were talking about different concepts of beauty and how it relates to how we feel about ourselves, surgery, starting businesses, how it's seeping into all of society, almost inundating us. And now we're going to switch a little bit and really talk about how it's affecting kind of the African American community. As a plastic surgeon, I can tell you, when I started med school, I watched one plastic surgeon. He was doing liposuction, and he was liposuctioning this woman's thigh and her butt. He was making them smaller, and he looked at me and my colleague and said, "This looks great, doesn't it?" And I'm thinking, no, it looks terrible. I would never like a woman like that. I was a student, so I said, "Oh, yes, it looks great." But the last 6 years, the number one procedure that's increasing plastic surgery has been BBL, Brazilian butt lift. Liposuction everywhere, and take that injected into the buttocks, okay? These images are images that pretty much accentuate things that Black people naturally have, okay? And we want them. I can tell you from experience that Black women who were not blessed with, big curvaceous butts are some of the most serious, fervent customers, like, give me a butt now, okay? And with that being said, we're seeing monstrous butts all over Instagram from not just Black people, but non-Black people. But our kids are seeing this too, okay? Are you seeing this as well?
Oh, yeah, it's everywhere. And that's what the kids, are going after. But I have to say this. I don't know, as a Black female, I'm going to speak from this perspective for a second. I feel like having those procedures have been, taboo at one point, right? Like you said, it's more accepted now, and it's something that we engage more in. And so the kids are like, yeah, this is the thing. This is what we need to do. This is what we aspire to do. And so, again, it's trying to balance that message with, okay, if that's what you want, fine, right? But how can we make sure that you good, you happy, confident, and safe, right? So
I'll tell you, one thing I tell my patients, and I think I told you this before we started, is that I look at plastic surgery like invasive and long-term makeup, okay? Nothing I do is permanent. It's all fleeting, but it's something you do for a time how you want to look, but it doesn't change who you are. Your lipstick and your makeup are not changing who you are at all, okay? And plastic surgery is the same thing. It just kind of makes you look a certain way for a certain amount of time. It is not permanent. Now, with BBLs, they are so popular that people are doing some kind of shady things, okay? Frequently, people are flying to the Dominican Republic, Mexico, anywhere they can. They say homeboy's garage, you name it, and having hacks do all kind of unsafe things, and they're having all these complications. So much so forth that the American Society of Plastic Surgeons, as well as the Aesthetic Society, which I'm both part of, sent these massive letters out like, gotta do this, you gotta do this, be on the lookout for that. And a lot of people are getting arrested in Florida now. You no longer can do as many BBLs as you want. There's a limit on it. So now I'm coming back to you. When it comes to malpractice and what happens if my doctor didn't do a good job? What if my doctor wasn't necessarily a doctor? What if I had something done by a nurse practitioner or NP and it didn't go right? What happens with all that?
Well, it really goes back to the setup. If I'm a nurse practitioner and I am doing a surgery, that you're practicing outside of your scope.
Mm-hmm.
Just because you're in a state that has full practice authority doesn't mean you can all of a sudden be a physician or a surgeon, right? My husband is a neurologist. He can't do a surgery. So if you're practicing outside of your scope and you have a license, your license is likely to be suspended. But your malpractice, and this is for my practitioners, your malpractice covers you practicing within your scope. If you're doing something outside of your scope, your malpractice coverage is not going to cover it. So you're coming out of pocket for that patient's damages, right? Because if you maim someone, harm someone, kill someone, you're paying a lot. Not only are you losing your license, but at the same time, depending on what you do, because, Dallas was the city of Dr. Death, it can be a felony. You can go to jail. These are jailable offenses. So if you're a nurse practitioner performing a surgery, right, that could be seen as a jailable offense because you're practicing outside of your scope. So those are the things that, we try to, when we're dealing with, whether it's a doctor or a nurse practitioner or a doctor working with a nurse practitioner, just, informing people, hey, all about you trying to set this up, but we have to make sure that you know what you're doing, making sure that everybody's educated and making sure you are practicing within the scope that you can. Because malpractice is a beast. And people, when they're on that side, I deal with people on the happy side of starting something and on the sad side of people crying like, oh my gosh, I'm up in front of the Texas Medical Board, or oh my gosh, this is, really, really bad. I'm going to get my business shut down. I'm like, you could go to jail. We're beyond shutdown of business. So there are a lot of things that you got to think about when you're starting something new.
All right. Now, I'm going to talk about something that I kind of just want y'all's opinion on, okay? Because this day and age, you almost can't do a show about concepts of beauty without talking about weight loss, okay? And weight loss surgery and the shots, the Ozempic, the semaglutide. Or I went to actually a dinner last night and they called it semaglutide. I felt so now, it's a diabetic medication.
Yeah.
All right. Most people who take it, or most people who used to take it, were diabetics who had to go to their doctor to get it. Not so much right now. Okay. Is there a legal ramification from getting your Ozempic or Wegovy or whatever you're taking from a non-traditional source?
Legal ramification for who? For the patient?
Yes.
No.
Okay, what if they find it online from Canada or whatever?
Patients find things online from anywhere.
Okay, what if they get it, it's not the real product, which it frequently happens, and they're mad.
No, but see, okay, so if you are buying a product that is not what it's advertised to be, the manufacturer of the product has an issue, and the person who's giving it to you, the distributor, like if it's a doctor or it's a nurse or a clinic. So if you're giving a fake product, you as an owner of a practice, you got to really be on the lookout.
But what if they're in Canada? That happens all the time.
Yeah, but
because they're not regulated by our laws. Correct?
They're not regulated by our law. So you kind of take it at your own risk. And that is, it's buyer beware. That's why you and other people providers are advising people not to do that. Now, I'm a full believer in Ozempic. One of my employees, she has diabetes and she's literally lost 50 pounds. I'm like,
that's
woo!
That's a lot.
I got Ozempic too, right? But it's scary because I've also seen the negative side effects of it, because Ozempic is also has a lot of people going after them because of the side effects, like a lot of GI side effects with Ozempic.
Well, not just that. Okay, well, there are a couple of side effects. Well, one, so how most of these products work out, I'll be Dr. Clark right now, is that it kind of slows down your intestinal motility, okay? You feel full, like you cannot eat. You're like, if I eat any more, I'm going to vomit, okay? So you eat way, way, way less. That's just one of the side effects of it. Okay, but that's the
side effect.
that's the side that's the side effect where most people lose the weight. Okay, because they just can't eat anymore. They feel so full off a little bit of food. But the issue is, like they're running out of it, and not actually I take that back. They're not running out of it. It's just getting more difficult to get. Okay. And people are mad because the real diabetics are like, I need this because I'm diabetic. And other people are like, I want this a lot and I will pay to get it.
Yeah.
Okay. And here's the thing. It works. These medicines work while you're taking them. Once you stop taking them, guess what? Your intestines run normally. They're like, I'm hungry. So people want to eat and they gain the weight back. I know people who've taken them. Like my friends, they call me up like, can I take it? And I tell them, dude, if you're not diabetic, you shouldn't take it. That's Dr. Steve. But everyone else is like, nah, I'm taking it. I've seen what it did to my friend or whatever. And, they take it and they lose weight and they're happy. And then they get off of it and they're depressed. So what are your thoughts on taking a medication for a desired effect? You get that effect, but then you stop and it's gone. As far as like your mental stability, like your like depression and your thoughts of self-worth when you're all of a sudden it's no longer there.
Right. So, of course, I can only go back to, my area of expertise, which is, young adults and young people. Again, that goes back to the why. How do we even get to this space of even, and I get it what you're talking about. Were you going to ask another question?
I am, because I'm thinking about those kids who are taking the psych meds. A lot of psych meds make people eat a lot. Mm-hmm. So sometimes you can give some people psych meds and they will gain 50 pounds in like 3 months, like it's nothing.
Yeah.
And we just deal with that. We're like, hey, but you're not having the psych issues anymore. But the kid or the adult has gained all this weight and they might be a little depressed because of that. So when you're talking about some of those psych meds on some of those kids who are now obese, because that was the conversation. Do we put these kids on Ozempic and Wegovy?
Mm-hmm. So you're asking, how do we address that change? Yeah. So again, that's the importance of not just putting children, I think, or anyone on just medication and not dealing with the psychological impact as well. It's kind of like there's behavioral modification. So in other words, you're going through counseling as you are taking this medication so you can deal with these changes that are going to occur as a result. The side effects, right? Or what happens when you have to stop taking it and your body changes all of a sudden, your mood changes. You're dealing with it and you're addressing it all along. So you should never just be, in my opinion, taking just any type of psychotropic medication without the behavioral cognitive intervention, right? So you can address it together. Does that make sense?
Yeah, it does. You're definitely a PhD. We're both like, man, she's really smart. She's but we get the gist of that. It's not a one treatment thing that cures everything. If you're going to take the child or the person and look at their psychiatric condition and treat it, then you need to treat it all parts. Kind of like if you're going to go to war, you don't just fight with your Marines, you fight with your Army and your Air Force, and you take the whole war. That's the gist I got from my big brain friend.
I'm in good company.
I tell you, the semaglutide shots, I'm sorry, the semaglutide, as the fancy people say, injections I know so many people on them that are not diabetic. Mm-hmm. And I cannot deny that they are losing weight. And it's a real, ethical dilemma because they are losing weight. They are happier. Their health is better. But is this now a drug that they have to take all their lives, like a hypertensive drug, even though it's not a chronic problem? I mean, is obesity a chronic problem? It has a code. It's treated like a chronic problem in our medical textbooks, but society doesn't really treat it like a chronic problem. And I must say, I'm kind of on the fence on. I don't know yet either. That's what talking to some more smart people.
Hey, I mean, how do you feel about these drugs? Because as a plastic surgeon, some plastic surgeons, or I have a client friend.
I have friends who prescribe it. Absolutely.
Literally, they don't like these drugs. So they're like, oh, people are doing less surgeries.
Okay. I'm going to tell you all about that when we come back from break.
Being a parent, especially for the first time, with that comes a lot of self-doubt. As a dad, I just try to lead by example. When you're trying to be the best person that you can be, your kids see that and then they emulate that.
Welcome back. When we left, Doris Dike had asked me my thoughts on Ozempic and Wegovy and so on and so forth. And I'll tell you, I am a fan, okay? I think that they absolutely let people lose weight. And to me, there's nothing wrong with vanity, okay? As a matter of fact, that's the primary reason that we are taught as plastic surgeons someone should get surgery. If they tell us, I'm getting surgery or I'm losing weight for a job or for my husband or for this result, we are taught, do not operate on them. Do not do anything, because they're basing their success, their happiness on a result which my surgery has no control over, okay? Now, I'm a little bit weary on physicians prescribing this medicine and they have no idea how to manage it, okay? If you're an ER doctor and you're just running a Wegovy clinic, like, are you running the proper labs? Are you checking this, that, and the other? So I have a problem with that. And even some of my friends who are plastic surgeons who prescribe these medications regularly, if you're doing it, like, to me, just to get a quick buck and you're not really doing the medical work, I have a problem with that. But as a whole, I'm okay with that because I'm okay with vanity. We are vain people. It is natural. Everyone is vain a little bit. If someone says they're not, they're lying. They are vain about something, okay? I have my own personal vanities. Vanity drives my business, all right? But, when it comes to beauty and surgeries, we can change things. And I enjoy changing things. And it affects everybody. It affects men as well. What questions do y'all have as, like, non-plastic surgeons about concepts of beauty and plastic surgery that I can answer?
This is something I do want to ask you about, because I think about when we talk about the standards of beauty, it tends to always go back to, not always, but frequently go back to women, right? Trying to alter, change things, whatever the case may be. So when I think about young people, though, again, same thing, like, oh, how do girls see themselves? Let's, how are they impacted by social media? But it's the males and the boys that I think get overlooked, that they are not impacted, but they are equally impacted. So I'm not a man. I'm not going to speak to it.
Okay.
But you,
yes,
as a man, how does this industry impact you? How are you all inserting yourselves into this industry?
Absolutely. The more people are out there, the more men are affected, and we do things too. Now, men do more face things, okay? Things like Botox. I use Botox. I inject myself every 3 months without fail. I call it crack because once you have it, you're hooked. And I injected myself just trying to prove a point to my wife. And 2 weeks later, I was like, I'm on the crack. Every 3 months, I give it to myself, okay? As we age, men, they want to look better and they don't want to get pushed out of the workforce because they look old. And someone's like, Jeffrey, look, how old is Jeffrey? How much we paying him? How long he been there? Maybe I can get a younger, cheaper model. So now Jeffrey's coming to get his eyelids done, his blepharoplasty or his facelift. Oh yes, men, we are human. We are vain creatures, and that's okay. But men tend to do the face things or the lipo. I did liposuction on a friend of mine who's an anesthesiologist, okay? His wife wanted some lipo, so I did his wife. She looked great. And then 6 months later, they went to Hawaii, and he's on Facebook, and I see his pics. They look all happy. And the week after he came back, he came to see me. He's like, I want lipo. I said, let me guess. You went to Hawaii, and your wife outfined you. And you know what he told me? He said, yes. So I did lipo on him. So men want it too. We probably a little more secretive on what we do because it's still kind of taboo for us. But men do it too. Like I said, we are humans. We are vain creatures, and that's okay. But men tend to do the lipo and the face stuff. And Botox as well.
I never even thought about the impact until you just said that on things like job related.
Oh, yeah.
Like I always think about females. We think about that, right? And aging and, but yeah, so thank you for that enlightenment.
No, what questions do you have, if any?
I don't know if I necessarily have a question. I just think that the standards of beauty, like you said, are changing. How do you see the standards change between different races? Like we talked about.
That's a great question.
Caucasians and versus African Americans.
I tell you what, the job of the plastic surgeon is not to put our concepts of beauty on the patient. Okay, patients have their own concepts of beauty, which if you're a good plastic surgeon, you acknowledge. Okay, everyone doesn't want to look like Serena Williams. Everyone doesn't want to look like Britney Spears. Everyone doesn't want to look like Jennifer Lopez. Okay, we all have our own concepts of beauty, and it's a beautiful thing. I love it because, like, take my BBL patients. Every butt's not the same. Some people want a shell. Some people want upside down heart. Some people want project. It's whatever you like in your culture, in your whatever your values are. And so I encourage all patients to lean in to whatever it is that they find beautiful, okay? If you want a small waist and curvy hips, but not a lot of butt sticking out like a shelf, that's fine. That's perfectly fine. We can do that, but love it and accept it. I tell people, if you get something that other people like, but you don't like, you're going to look in the mirror every day and say, better, but you're never going to be happy. It's about you looking in the mirror saying, yes, I look good. Look at that. Look at my small waist and big curvy hips. Or look at my small waist, no hips, all this butt to the back. Look at my big breasts, okay? And sometimes we have to be honest with ourselves about what we really like. Because sometimes the society's view of breasts. My sister, I had a woman, she said, what do you do when a patient comes to you and they want breasts that are too big? I said, what's too big? She said, you know what's too big. I said, no, I don't know what's too big. She's like, you know what's too big? Like the big, I was like, listen, your concept of what's too big is different than that woman's concept of too big. I had a woman, she came in, she said, Dr. Clark, I want the biggest breast possible. I want to look like a stripper and like a porn star. She said, if you're thinking too big, that's what I want to go. And I'm okay with that because you know what? That's her concept of beauty. And my job is to what? Make her happy. So I measured her out and lo and behold, her chest wall, which is really the factor when it comes to implants, could actually hold the biggest implant, which is about 800 cc's, okay? So I gave it to her. And guess what? She loved it. She and her husband loved it. Now my sister saw her picture. It's like, oh my God, those too big. But that's on you. And I think that's a good way to I think I love that example because for far too long, society did that. Okay. In the 80s, everyone was pushing this, the Caucasian image of no lips, no waist, no butt. All the models had all that. Okay. And told black people and everyone else, this is what you're supposed to look like. And so many young little black girls wanted to look like that. Buying, white Barbies and this, that, and the other. And I think that was a mistake. People should just accept what they want. And we shouldn't force any image onto anyone else. We should just acknowledge what we like and be okay with it. Because that's the only way you're going to get happy. I can do all kind of things, but if you don't tell me what really makes you happy, then you're never going to be there.
I have another question, Dr. Clark. As a physician, do you get patients who've seen another doctor who have been botched and they come to you? Because for me,
yes,
I have people who give me stuff that I'm like, I'm not going to, you went to LegalZoom, this is bad. I don't. They go to the Dominican Republic and they get discount surgery and it's not good and they're affected and they're like, can you fix it?
for the same price as Dominicans? And the answer is no. I can try to do things, but it's going to be at this real price. Now, Botched. There's, a TV show called Botched. I like to call that show Known Complications because any surgery you do, there are known complications. People say, I had a breast augmentation and I got one nipple this way and one nipple that way. I guarantee you the day of surgery, it wasn't like that. The day of surgery, the nipples were probably straight, probably looked great. But there's something called capsular contracture that you make scar tissue that will move an implant. That's a known complication, okay? So remember I told you before, nothing I do is permanent, okay?
Mm-hmm.
People have surgeries and their results can look great at first, and then they don't. Those are just known complications. If you put on eyeshadow and you wear it for 3 or 4 days in a row, it's not going to look the same way as it did the first day.
Is there a severity where you will not operate on that person? Like you see somebody who went to the Dominican, they got cut up, and you're coming to you.
I do what I think I can do well. Okay, if I can operate on that patient and give them their desired result, then I will. And if I don't think I can, then I won't. And I've learned from experience that it's just better to say no to certain patients than try to give them expectations, which I'm probably not going to hit.
Yeah, that
because half the game is expectations. I'm a big believer in underselling and overproducing.
Absolutely.
What other questions you got? That actually, I'm gonna ask you because you guys are my big brain folks who are all cerebral. But remember, we have people who are not in the clouds, okay, and they want to know about some simple things that their friends are telling them about. Do you have questions that like all your friends are like, I wonder about this, I wonder about that with plastic surgery?
I think that Dr. Clark, you and I had that conversation in the back that you said that a lot of people it's cost. Yeah. I was saying that for me, it's not cost, it's scary. It's scary to get operated.
I'm glad you said.
Because, I'm a lawyer. I read the complaints of the Texas Medical Board. I frequently do, medicine in the news, and I'll talk about crazy stories that I see. So for me, even thinking about a surgery is just, outside of cost, it's just a scary thing.
All right. I'm glad you said that because even though it's not cost for you, for most people it is cost.
Right.
So we're going to talk a little bit about the money because this is not like going to the Nordstrom's and buying a suit. You don't like it, you turn it back. If you get plastic surgery, you don't like it, I get my money back. No. That is part of the deal, okay? If you're unhappy with your surgical result, then, it's like I give you a hug and rub your shoulder and say, I'm sorry. Now, luckily that doesn't happen to me for the most part. But I have friends and they tell me about these things and we have conversations like, do you give the patient your money back? And most surgeons are absolutely not going to give you your money back. One, they don't want to act like they're guilty, like legally, because if you give money back, it's like saying I did something.
An admission of guilt.
Yeah, it's an admission of guilt. But two, it's an art, okay? There's no perfect surgery or whatever. So people, it's not like buying a suit when you want one. So if you have a bad result, would you get your money back? No. Are there payment plans? Usually, no. I joke with my patient. I say, yeah, we have a payment plan. You can pay half now to get on schedule and half a week before surgery. That's the plan, the 2 payments. Are there ways that you're like, hey, can I finance it? Yes, you can. You can finance. There are about 3 or 4 different agencies that you can Care Credit, and one's called Cherry. I forgot, like United something, where, like a credit card, you give them your information, they run your credit, they say, yes, we'll approve you for $10,000 for this plastic surgery procedure, and, we won't charge you anything for the first year. I'll tell you this, I use all those agencies. However, I would avoid them if you can, because their interest rates are predatory for the most part. Like, they won't charge you anything for a year, but then they hit you with like 25% interest. I mean, it's rough, okay? So if you know for a fact you're going to pay these companies off before those rates hit you, fine. But, it's not, your rates are sky high. What else can I say about the cost? Most plastic surgeons are going to want everything up front. Okay. Most plastic surgeons are going to collect the whole fee. Whether you know it or not, you pay anesthesia, facility, and the surgeon. Okay. And then what you pay covers all your visits for 3 months. That's the law. Your global period, 90-day global period.
I have one. This is just to follow up on something that you said about people wanting to get their money back if they don't like the result. Correct. But I know you don't have many of those situations that happen. Because what do you do to assess their level of readiness to review a procedure?
Talk to them extensively. Okay. The last thing I want is an unhappy patient. Okay. So I get down deep into their true desires, because that's what it's all about. Did I give them what they wanted? Okay. If I feel like I can give them what they want, and I feel that this is truly what they want for the right reasons, then we're good. Okay. So what I do with my patients, we have an initial consultation with actually me. A lot of plastic surgeons have like their underlings do that, but no, I talk to my patients. I call it a first date, and nothing really. I call it first date because chances are nothing big gonna happen. Okay, I'm not going to take the picture. I'm not going to take their money. I'm not going to schedule for surgery. We talk. They express their desires and wishes. I tell them what I can do. I give them other things to think about so they can go home and realize the things that they didn't even know. That's kind of my job, to tell you things that you didn't even know about. And then the second day, if there is one, they come back and we really get into the weeds of it. And if any of those dates, any of those appointments, I identify something suspicious, or, that maybe they're a little bit mentally not ready, or, then that's when I address those issues and potentially delay or refer out or just frankly refuse. You can say all money ain't good money.
Right.
All surgery ain't good surgery. Okay. I'll pass on a potential angry, bad patient. All right, you guys, last one. Is it any last minute burning questions? Because we could talk about this really all day long, but this first Black Medical Journal podcast has a time limit. Any burning desires or questions? All right. Well, I'd like to thank our ladies for joining me and having this great discussion. This is our first podcast for the Black Medical Journal. We're going to have many more podcasts where we discuss all things related to Black health and health services, and hopefully we'll talk about some cosmetic things here and there. And I'm just so happy you joined us today.